Hi, this is Jack Daulton again, and I'm here with Roz Ho, my fiancee, my partner, my cohabitant of nearly the last 11 years. We met on a trip around the world in the year 2000, and we've been together ever since. She's a very accomplished woman, an executive at Microsoft, and she's been through my side during this entire ordeal and been invaluable. I'm at home now. That's important to say. I'm no longer in the hospital. I came home today. It is day 4 of my brain surgery experience.
And you're not wearing your stylish hospital gown anymore.
Now I'm wearing normal clothes. It's still a bad hair day though.
It's growing back, honey.
The surgery was on March 14th. It's now St. Patrick's Day, March 17th.
Oh, happy St. Patrick's Day.
Thanks. You know, I've got a wee bit of the Irish in me.
Very, very little.
Mainly Scottish and Spanish, but I do have some Irish in me. I just wanted to point out a few things about my experience that I haven't discussed in the previous 2 parts of this brain surgery trilogy that I think might be of interest to all of you. You know, I don't know if some of you noticed, but there's a blemish on my otherwise pristine forehead. It's kind of reddish or brown, Roz?
It's red, just a little bit.
Now, some of you might be thinking, Jack's a bit old to be having acne at 54, but in fact, that marks the spot where the framework that immobilized, one of the spots where the framework that immobilized my head during surgery was literally screwed into my scalp. There are others of those that are covered by my hair, but the head had to be, of course, completely immobilized during the surgery. And this framework also enabled them to pinpoint exactly where they needed to remove the skull to access my meningioma. So it's an important part of the technology involved in a brain surgery of this type. I think it's also important to point out, Roz, that I've had no noticeable cognitive losses as a result of the surgery. My speech seems to be the same.
Yeah, you're certainly not at a loss for words.
I seem to be reasonably articulate. My personality and sense of humor seem to be intact. I seem to be the same old Jack Daulton in short.
I know. You were really worried about that before you went into surgery.
Yeah, as I think I've said, that was my greatest fear, that I would emerge from this surgery a different Jack Daulton, Jack Daulton 2.0, and maybe not, you know, not the same old Jack Daulton that everyone knows. And I'm so glad that wasn't the case. To test your cognitive abilities, they ask you questions as soon as they awake you or arouse you from the anesthesia right after surgery, you know, to see if you're cognitively intact. And they did that in my case. They do that in the operating room, and then they also do that in the room just off the operating room.
The recovery room.
The recovery room. And they allow one family member in that room while they're doing that to ask you some questions also. And Roz was that person in my case, and she asked me some questions about geography to test my mental acuity post-operatively. And what were those questions, Roz?
Well, the first question I asked him was, what's the capital of Burkina Faso? And to my dismay, he had to think about it. He didn't know it right away. In fact, he kind of struggled for a while and then kind of came up with, what did you say? Whoa.
I said, Owango.
And I said, okay, that's close. Because it's really?
Ouagadougou.
Right. Well, you know that now. You're a little hesitant out of the operation.
I mean, some of you may be thinking, what kind of a question is that to ask someone who just had brain surgery? But in fact, Roz and I have been to Burkina Faso and have been to Ouagadougou. But even when I'm in the clearest state of mind before my surgery, that would have been a difficult question to answer because I've always had a hard time with the name of that capital city.
I actually really love the name, so that's why I asked you that question. But then you came back with...
I said, well, ask me another question about geography. I didn't want that to be the final word on my cognitive state.
So I said, what country is Timbuktu in? And you instantly said, Molly.
In West Africa.
And the people next to us, actually the patient and I think a couple of nurses there, just started laughing and said, I didn't know where Timbuktu was. In fact, I didn't know Timbuktu was a real city. So they just started laughing.
And then I can't believe he knew the answer to that.
Yeah.
And then I think I went on to ask to follow that up with having dialogue with my neurosurgeon, Dr. Alan Efron, asking him about this obscure topic, scalp necrosis, which I had some obsession and paranoia about before the operation. And scalp necrosis is a very, very rare side effect of this kind of surgery involving your skull and your scalp, where the blood supply is compromised to your scalp. I think I mentioned this in some of the other videos. And the scalp dies, and there has to be a skin graft. And so I asked the doctor, how does my scalp look? Any signs of scalp necrosis? And he said no. And that just, I think, demonstrated to everybody that my sort of sardonic wit was still present
fully
as well.
Intact.
Yeah. In any case, another subject that I think is worth mentioning is pain, because I was really worried about pain.
You were.
That I would be in great pain when they aroused me from the anesthetic. And in fact, I've experienced hardly any pain at all. I've had a few...
Really surprising.
Yeah. I mean, they have...
Not even a headache.
Think about it. They made a big incision in my scalp. They removed a large section of my skull, basically 4 by 4 by 4. And that is the hardest bone in your body. They broke a bone in my body and then worked on an area.
Poked around in your brain.
Yeah. And yet, I've experienced almost no pain except a few low-grade headaches that have been treated with nipped in the bud with some painkillers. Other than that, I'm fine. I've had some throbbing of the scalp, but it hasn't been accompanied by pain. So that's really remarkable.
Yeah, you've had maybe 3 painkillers.
Now, I am on some medications. Probably the most important medication I'm on is a steroid to reduce the swelling inside my brain case, because post-operative swelling after brain surgery is the most dangerous side effect, because that swelling can actually damage the brain and damage it permanently. And people that seem fine when they first come out of surgery can deteriorate because of the swelling of the brain. And so they've been administering me a constant supply of steroid, and that will anti-inflammatory steroid, and that will continue for the next 2 weeks or so. I'm also taking an anti-seizure medication, Keppra. You know, after you've had brain surgery, another one of the common side effects are seizures. Your brain is stimulated and irritated by the surgery, and that can cause it to misfire. And a misfire of your brain, your neurons, is what causes a seizure. And in my case, the brain is slowly beginning to expand into the area previously occupied by the tumor. And during that process of expansion, that movement of the brain matter, misfirings are very common. So seizures are a very common side effect from the kind of surgery that I had, and the anti-seizure medications are intended to control that. Now, I've only had one incident post-surgery of a mild seizure, and that was some slight twitching of my hand on day 1 for about 15 or 20 minutes. But since then, I've had no seizures whatsoever, no evidence of seizures. And the only side effect from the Keppra is that I've been a bit drowsy. The Keppra lowers your brain activity, and in an effort to minimize the incidence of misfirings, and one of the side effects of that is to make you kind of lethargic, and I have been rather lethargic.
Yeah, but those are some pretty powerful drugs that they have you on, and it's really important that you take the dosage at the time they tell you, and it's actually rather complicated because for the steroid drugs, they vary your dosage and the times that you take it for the next 12 days. In fact, it's so complicated when we got home that I made this lovely drug chart using PowerPoint, so Jack knows exactly when and what to take every day.
Yeah, otherwise it would be really complicated to keep track of that, because it's so important to take these medications at the proper time. Roz was one of the people that pioneered PowerPoint at Microsoft, and here it is, so handy in my current circumstances. Another point that I think we should make in this final video of the Brain Surgery Trilogy is one that is so positive, and that is my pathology report, the nature of my tumor after it was examined in pathology. There are 3 types of meningiomas. Type 1 is benign, it's not aggressive, it's not metastatic, it's not cancer.
And 90% of the meningiomas are that type.
Are benign. Type 2 is an atypical meningioma. It's aggressive. It intrudes more into the brain, it's faster growing, and about 8% of the meningiomas fall into the type 2 category. Type 3, of course, is the worst type of meningioma. 1 to 2% of the cases are type 3, and that is a malignant or cancerous metastatic meningioma. Gratefully, my pathology report revealed that my meningioma is a type 1. It is a benign meningioma, the least likely to recur. It's not cancerous, it's not aggressive. I will be monitored once a year through an MRI, imaging my brain to see if the tumors come back, once a year for the next 5 years.
Well, actually, they're going to take one in 6 weeks.
6 weeks, and that will also tell them how much my brain has come back to occupy the space formerly occupied by the tumor. But,
golf ball size.
Yeah, remember, golf ball sized tumor, so the brain is filling that space back up, springing back and eliminating some of the symptoms of caused by my tumor, hopefully as a result of that. But then just once a year for 5 years I'll have an MRI and then a clean bill of health. If they find any recurrence, they'll zap it with some radiation and hopefully that will take care of it. But hopefully there'll be no recurrence. Another thing I'd like to report is that I had an erection yesterday. So apparently no sexual dysfunction as a result of this procedure. And then finally, I'd like to make one more point, and that is that I'd like to thank all of you, my friends and family members who have been so supportive of me, reached out to me with words of kindness and support during this ordeal. It's meant so much to me, and I've learned so much from you about myself in these kinds of experiences. You know, I tend to take for granted the relationships I have with friends and family members all over the world. And through this experience I had, I realized how important those relationships are and how they shouldn't be taken for granted. And moreover, how important it is to reach out to a friend who's in a position like mine or worse with words of kindness and support. How important that can be to the individual in question. And I tend to carry the lessons I've learned forward with me through the rest of my life. And I hope to, as I said in one of my Facebook posts, I hope to see each and every one of you face to face sometime during the next year so I can thank you myself personally for the support and kindness you've given me and to reaffirm our relationships. So thank you, Raj. You've been with me from beginning to end and continue to be there for me. And thank all of you as well. Bye-bye.